this month, the topic of the month is infectious diseases. So today I'm doing just a little short blurb on what infectious diseases are and give you a little information about that. Next week, Dr. Chima will be here and he'll be talking about sepsis. Next month, our topic is on cancers and neoplasms. Okay. Also, you need to remember to get in the Healthcare Academy and get your things done in there. Some of the in-services, and I usually will let you know through when I work, if the in-service that we're doing that particular day gives you credit for anything in Healthcare Academy. Okay? So, be watching, be busy, be doing it. If you keep up with it, by the end of the year you won't be sitting there going, oh my God, I have 27 of these suffers to do. So, do them now. Okay? Because I add about 4 or 5 a month. So, all right, we're talking about infectious diseases. There are 2 categories of infectious diseases, and they are newly emerging and re-emerging infectious diseases. Newly emerging diseases are those that are recognized in the human body for the first time. Okay? And re-emerging are those that historically have been reported in humans but are coming back. Okay? Or appear in a new location. It could be geographically, or it could be in the body itself, or drug-resistant forms of a bug coming back, or they reappear after they've been controlled or eliminated. Does that make sense? Okay. The World Health Organization in 2007 reported that infectious diseases are emerging at a faster rate than we've ever seen before. Since 1970, we've had 40 different types of infectious diseases accounted for. Okay. Some of those were SARS, MERS, Ebola, chikungunya. What the? Don't ask me to say it, but it is. Okay. Avian flu, swine flu, and most recently Zika. Okay. And the problem is, the world is evolving. We travel more. We travel to farther places than we ever have before, greater distances. We live in more densely populated areas, and we come in closer contact with wild animals. And the potential for emerging infectious diseases to spread rapidly and have global epidemics are a major concern. Okay? And then there's the other thing is the potential for terrorism that are deliberately introduced into the population, whether it be plant life, or it be animal life, or it be humans. Such funny, huh? Okay. For an emerging disease to become established, it requires at least 2 events to occur. The first one is the infectious agent has to be introduced into a vulnerable population. And the second one is the agent has to have the ability to spread readily from person to person and cause disease. Okay. The infection also has to be able to sustain itself within the population, and that means more and more people become infected. Another factor that's especially important is the reemergence of diseases is the acquired resistance of pathogens to antimicrobial medications. So that's where we get the MRSA and the VRE and those type problems, because not only do people get to feeling better and they stop taking their antibiotics before they need to, which produces a stronger strain that's more resistant, but sometimes the drugs that we're using are not sufficient enough. In the last 5 years, we've only had 6 or 7 new antibiotics introduced into the market. So we're going on 1st and 2nd generation antibiotics, where the 3rd generation coming along, there's only been like 6 new ones. So every time you go to the doctor and you think, oh, this is a new drug, yada, yada, yada. Well, the problem is they're not manufacturing them or discovering them as fast as they used to. Another thing that's causing problems is climate change. That's an increasing factor. The Earth's climate is warmer, and habitats are altered. Diseases can spread into new geographic areas because you have mosquitoes, you have different things that transmit bugs or infections. So you have a place that was really cold, they didn't have those type of problems. Well, it's warming up. So now those type of insects and things are moving out into those new warmer areas. So it's creating issues that way too. One instance of a tropical disease that has spread is my favorite one. Chikungunya. I don't know how you actually say it. And it's caused by the chikungunya virus, which is relative to dengue. And y'all have heard of dengue, right? No. Dengue fever?
That cream you rub on your body.
Okay, so dengue is transmitted by the tiger mosquito. And in the past, it's only been confined to tropical regions around the Indian Ocean. Well, in the summer of 2007, more than 100 residents of the town of Rehab in Italy suffered a mysterious disease that produced a fever. Guess what it was? Dengue. Okay? By 2014, they had outbreaks of this virus in countries in Europe, Asia, Africa, the Americas, Caribbean, Central and South America. So it spread pretty rapidly in just 7 years. Okay? Then we have a new one out called Zika. Y'all have heard about the Zika virus, right? It pretty much has things to do, it's more prone to pregnant women. Okay? They're still learning a lot of different things with this. It's associated with birth defects and microencephalopathy, okay? And then we have the Ebola virus. Did you notice how fast it spread across the ocean? No? Okay. And it used to only affect small groups of people in Africa, perhaps maybe 100, but it can sweep through areas now and kill tens of thousands. Okay? Let's see. Other non-abroviral examples of emergent infections is cholera. For centuries, it was associated with the global travel, changing of the seasons, war, natural disasters, that type of thing. Also, unsanitary conditions and poverty and social disruption. Well, one of the things that has caused is for us to have an emergence of C. diff worldwide, okay? Also with the MRSA, because the bugs are stronger. How can we eliminate some of these infectious diseases? What do y'all think is one of the biggest things that y'all can do to help prevent the spread of stuff? Wash your hands. What did we get cited on? Hand washing. So, the two things that you need to do, wear gloves and wash your hands often, okay? You remember you're supposed to wash your hands before you put your gloves on and wash your hands after you take your gloves off, okay? Another thing that is spreading around is influenza, different strains of influenza. Every year, our flu vaccine is different strains of the flu bug. They're looking at what is more prevalent in the regions surrounding us. Let me see here. Okay. Another example of a more modern infectious disease is HIV. It used to be HIV/AIDS, and now it's actually two separate diseases. You either have HIV and it evolves into AIDS. Okay? AIDS wasn't recognized as a distinct entity until 1981. Okay? Other examples of disease emergence is SARS and MERS. So as the world travels, the bugs travel too. now there's another one coming out. It's called NTM, non-tuberculosis microbacterial lung disease. This one is like TB on warp drive, okay? It significantly increases morbidity and mortality. So it affects the lungs, especially patients that have bronchiectasis, COPD, and asthma. So you have to be real careful. What are you gonna do? Wash your hands. Wash your hands. There are different kinds of tests that they can do for the NTM, but they're working on developing more testing and more drugs to help fight it. However, all good things take time, right? So that's about all I have on infectious diseases for you today. Dr. Chima is going to hit on sepsis next week, so you can learn a little bit more about how it works internally. Okay? So, if you have to be on antibiotics, take them all. Take every last dose. It's important. Okay? Any questions? Concerns? Issues? Okay. Y'all have a wonderful